having burning with urination, discomfort, lower abdominal pain? You might have a UTI. You might have something else. Good day, I'm Dr. Tia, and today we're talking urinary tract infection, UTI. Urinary tract infections are very common. They affect 50 to 90% of all women. And the reason why women are at a higher risk is because there is a shorter distance between the bladder and the outside world. In men, that distance is lengthened by the length of the penis, and that reduces the risk of having bacteria from the outside world reach the bladder. The most common bacteria is E. coli, which originates from the anogenital region. How UTIs present is varied. Some people will have burning when they pass urine. They will have small amounts of urine triggering a big urge response where you're like, I'm busting, I need to go. And you get there and it's just little small amounts of razor blade feeling like urine. Sometimes patients suddenly start waking up in the middle of the night to pass urine. And the urine itself might be cloudy, might have some blood in it. And the patient might feel like they have to go to the toilet a lot. That is called urinary frequency. So you're going 10 minutes later, you have to go 15 minutes later, you have to go 10 minutes. It becomes a full-time job to go to the toilet. Some people experience pain in their lower back, in their lower abdomen because of having a urinary tract infection. Sometimes people start to feel systemically unwell. They start to have a fever and feel a bit sick. Especially in the elderly, it can result in delirium, which is an episode of brief confusion where someone might not know who they are, where they live, and all the stuff, all because of a urinary tract infection. Now, not everything that quacks like that duck is a duck. So sometimes people come in, or they might have seen a pharmacist and thought they had a UTI, urinary tract infection, whilst they have chlamydia, which is a sexually transmitted infection. Sometimes people have thrush or irritation to the vulval or vaginal region, and as a result, there's burning when they pass urine because the skin is pretty fragile. Sometimes patients have dermatitis, which behaves the same way. It's irritated by contact with urine and seems to be a urinary tract infection. Now, the risk factors for having a urinary tract infection are being female, as I've already explained, and wiping the wrong way. There is a right way to wipe after urination, and that is from front to back. Because, as I have alluded, the most common bacteria to cause a urinary tract infection comes from the anus. So when you wipe it this way, you're basically dragging all the bugs from the anus right to the urethra, which is the opening of the urinary system to the outside world, and the bugs will happily travel up to the bladder. So wiping the other way, front to back, ensures that there's no bacteria from the back end reaching the urethra. That is also important after intercourse because urination will flush all the bugs that happen to be deposited to the mouth of the urethra during intercourse. Sometimes urinary tract infections become more common as people get a bit older, and that's because with menopause, the lack of estrogen can affect bladder health. Using soap-free wash and non-irritant washes to the vulva vaginal region and wearing cotton underwear also helps to reduce the risks of urinary tract infection. How do we treat them? Well, ideally we are treating by taking a sample of urine to the lab to confirm that what we think is a urinary tract infection is indeed one. You are also hopefully getting examined if this is not your first rodeo of having urinary tract infection, because there are many things that can present as a UTI that are not. And unless you go looking, you will have those missed by your doctor. Treatment is usually antibiotics. They are empiric at first, which means best guess. The doctor just thinks, hey, this patient probably has an E. coli. It is commonly killed by this antibiotic, and they prescribe accordingly. Now, When the urine result comes back and dictates that no, they didn't have E. coli, or actually they did have E. coli, but it's not sensitive to the initial antibiotic, then the antibiotic needs to be changed. That is why it's important to send the urine off, so that if the resolution of symptoms is not happening, we can look in and assess whether 1, was there a urinary tract infection to begin with, 2, what bug was causing the problem, and 3, which antibiotic is likely to kill that bacteria. Hydration. Hydration is very important when you're managing a UTI as well, because you want that bladder to be full and to be able to be flushing out the bacteria and the antibiotic as prescribed. So this is not the time to be restricting the amount of fluid you're taking. Till next time, hope that helps.